Without commenting on anybody's cooking, at the dinner table, nothing washes down something dry like a tall glass of milk. It's a drink fortifying our diets for centuries. At this point, dairy milk is actually kind of boring. Unless you turn your attention to a debate that's been bubbling up recently. Are we missing out when we pasteurize milk instead of drinking it raw, fresh from the cow? Legally, we can't buy raw milk in Arkansas, but now the debate over whether to change that is anything but dry.
When people experience it, it's going to be life-changing.
Raw milk has literally transformed a lot of people's lives.
Passions aroused over the most basic of beverages.
From a public health perspective, this genuinely keeps me awake at night.
A sample of voices on opposite sides of a trend. A perceived wellness benefit by drinking raw milk versus the public health risks of drinking milk that has not been rendered safe by heating it.
There is no safe way to handle raw milk that makes the risk zero or even negligible.
This is Carrot. That's my sweet girl.
Raw milk is having a moment. Across Arkansas, you find groups of people drawn to milk as fresh as possible. Rich in protein, it goes from inside the cows of places like the Live Healthy Farm in Garland County right into the bodies of the farm owners, Betty and John Ballard, and their young kids. They are unlikely midlife farmers.
There was a period of time where we're doing the city life, living in suburbia, on a plane every week.
There was a picture that ran through from 2019 where John and I were in New York City at a 10-seater sushi restaurant. And now we have a regenerative farm with 4 dairy cows on it.
The Ballards say as their unorthodox farming odyssey formed, they discovered a wider community that defies an easy label. It's a mix of traditional, environmentally and healthy conscious types associated with the left, combined with conservatives and libertarians. Drawn together because raw milk is, by law, deliberately hard to get.
There's absolutely nobody in Washington that's going to save us. This is a grassroots movement.
Logan Duvall straddles those ideological lines as the farm-raised part owner of Me and McGee Farmers Market in North Little Rock. He wants to sell raw milk at his stand.
In order to get raw milk, the consumer has to go to that farm and purchase it directly from that site. So anything outside of that is technically going to be illegal.
Duvall offers other things that make the move from farm to table a short one. But when it comes to raw milk, that move's unavailable. It's why customers who learn of the Ballards' raw milk literally beat a path to their door.
We have very dear customers that drive 81 miles one way to pick up milk. Their landed cost, their full expense is $21 a gallon. Now they can buy milk at the store for what, $4 or $5 a gallon. Mm-hmm. They choose to spend $21 a gallon, their full in cost, on our milk because it feeds their family, it's nutrient dense. I don't think they should have to drive 81 miles.
But for Dr. Jennifer Acuff, a food safety expert, that long drive is vital.
Raw dairy products, when they are consumed, are often associated with illnesses like campylobacteriosis, listeriosis, and historically it was associated with even more dramatic diseases: dysentery, diphtheria, tuberculosis, brucellosis.
Acuff has a PhD in food microbiology and has been all around the world, seeing what all those bacteria can do to a person infected by their food. She says that long drive forces the potential raw milk consumer to see firsthand where it comes from. And a farm is not a clean place. And while that desire to close the separation between the farm and our dinner table is enticing, actually seeing the dirt and the dung should turn many off. And to Acuff, that's a good thing.
A consumer going to the operation, to the farm, and seeing the hygiene, seeing where that milk is produced. Even if they don't see any bacteria, that product is still risky.
Acuff says raw milk has cycled in and out of fashion before, but this time she's worried. The nominee to lead the Federal Health and Human Services Agency, Robert F. Kennedy Jr., is a raw milk advocate. And part of why RFK Jr. has emerged as a leading voice is a function of the distrust of public health science after the pandemic.
They've said to themselves, after COVID or after the last several years of being told certain things, and the research that they personally do, come to the conclusion that, yeah, I'm going to go buy raw milk.
That spirit is behind the renewed effort to change the raw milk law in Arkansas. State Senator Alan Clark is one of those conservatives questioning the science behind it.
The opponents try to make it look like, and I think they mean well, that we're country hicks from Arkansas and we don't understand science, etc. And if we legalize selling unpasteurized milk at retail, we'll join other hick states like California, Washington, Arizona, and Massachusetts.
HB 1048 takes the current law and takes out the farm-only requirement. Sellers will still have to give a contact number, and the jug still needs a warning label. Senator Clark is the co-sponsor with State Rep Cameron Cooper of White County. Clark says the bill is about freedom and relays a family story about cousins who say raw milk cured their lactose intolerance.
The only milk they could drink was raw milk, and she said, "Alan, I shouldn't have had to buy a cow." And I'm like, I'm picturing my cousin, refined lady, milking a cow, but she's right. You shouldn't have to buy a cow.
Listen, this is work. You know, make no mistake about it.
No one we spoke with disputes the risk of drinking non-pasteurized milk. The Ballards insist they're not looking to get rich selling what their 4 cows give them. At $12 a gallon, they still barely make any money on it. They think the price and the hype will safely inform future customers at places like me and McGee. Dr. Acuff stridently disagrees.
Saying that this is a way to promote the local dairy industry is going to come at the cost of lives. People die every year, children, frequently.
We've been blessed, we've been afforded the opportunity to do this, and so by extension, if it brings abundance to us and we can share that with the community, then that's what we want to do.
HB 1048 is on the House Agriculture Committee's agenda this Wednesday. We'll bring you updates if the bill makes progress. In researching this story, surprisingly, both Dr. Acuff and Senator Clark refer to the same set of data from the FDA to prove their point. We've got links to that information in the digital version of this story on THV11.com. You can draw your own conclusions from it. But keep in mind, the amount of pasteurized milk consumption far surpasses raw milk in this country, and Dr. Acuff says that can skew the data considerably.